Mabuhay future nurses! Welcome to Maternal Nursing 101 with me, your student nurse, Edmond. In this video, I will be performing perineal care or the perianal care. So let us first define what does perineal care means. Perineal care means involves the cleaning of the genital area using a soap and water or water alone or in combination with any commercially available perineal wash, perianal wash. So, before proceeding with the procedure, we have first to conduct our initial assessment. So what are we going to assess to our patient? So first, we have to assess if there is a presence of irritation, excoriation, inflammation, or swelling around the genital area. Second, we have to assess if it has an excessive drainage. Third is, we have to assess if there is the presence of odor, pain, or any discomfort. If the patient has a the patient has a urinary or fecal incontinence, and if there is a presence of indwelling catheter. So that were the things that we have to consider before doing the procedure. So now we will now be proceeding on how we actually do the perianal care. So what are you waiting for? Come and let's watch it. Prior to doing the procedure, we have first to verify the client's identity, introduce ourselves, explain the procedure to the client, and tell the client how she will be going to participate in the said procedure. We will be performing proper hand hygiene and other infection control procedures, and we'll be providing client privacy by closing the curtains. So, good morning po, ma'am. Ako po si Edmond M. Bigata, student nurse po ako from Camarines Sur Polytechnic Colleges. May I know your name po? May I check your wristband din po, ma'am? Okay po. So, ngayon po ay magkakandak po ako ng perineal care. Bali, lilinisan po natin ang genital area po ninyo para po malesen yung odor at i-facilitate din po yung comfort ninyo as a client. So, ang mangyayari po ay lilinisan po natin yung genital area ninyo at magkakaroon na din po tayo ng inspection para po malaman natin if mayroon pong abnormalities. If meron lang po, malaman po natin at may report po natin agad sa ating healthcare providers. So, okay lang po ba yan sa inyo, ma'am? Sige po. So the first thing that we will be going to do is we will be folding the bed top linen onto the foot of the bed. And then we will be folding the drape of the client to facilitate the exposure of the genital area. Now that we've already done with the folding of the linen, we will now be assisting the client in the position. So, since our client is female, it is necessarily that we will be putting the client in a supine position with her knees slightly flexed and spread apart. So, to lessen the embarrassment of the client and also to provide warmth to the client, what are we going to do now is to drape the client. We will be draping the body as well as the legs, applying our gloves. Okay, now after we've inserted our gloves, we will now be washing the inner thigh of the patient using a washcloth. So we will be using only 1/4 of the cloth in each side, in each stroke. So first quarter, second quarter, third quarter, fourth quarter, and then discard. Now, what are we gonna do is we will be cleaning the labia majora and the labia minora using the same procedure. But this time, we will not be using any soap because it might cause irritation in the client. So we will be separating the labia, paying attention closely to the labial folds. First quarter, second quarter, fourth quarter, and then discard. So it is important to pay attention into the labial fold because the area between the labia minora and the labia majora has secretion accumulation. Now, these secretions that accumulated in those areas may cause or may facilitate bacterial growth. Now, we will be drying. We will be drying it. We will be drying it thoroughly. We have to make sure that we dry the genital area thoroughly because moist environments also facilitates the growth of bacteria. And after that, after we've dried thoroughly, we will be conducting an inspection. We will be inspecting the labial folds, we will be inspecting the overall ambience of the genital area for us to determine if there is an abnormalities present, if there is excoriations, and we will be reporting it to the primary healthcare providers if we saw any abnormalities with the vagina or the genital hair. Now, after inspecting, we will now be cleaning the buttocks using the same procedure. So we will be asking the client to position, using Sims position, he said lying position that is away from me. So, ma'am, position muna po tayo. Here. And then, it is better that we will be using toilet paper first before actually washing it, and then discard. Using the same procedure. First quarter, second quarter, third quarter, and fourth quarter. Okay. And then we will be drying the anal canal well. We have to remember that moist environments facilitate bacterial growth. That is why we have to dry it. We have to dry it thoroughly. Now, after we do the procedure, we will be putting the client back into its position, holding the bed linen, and then we will be discarding the gloves. Perform hand hygiene. And we will now be documenting the findings. We will be documenting the time we do the perineal care, and we also have to note if there is redness, swelling, presence of skin ablation, edema in the vaginal area, as well as if there is any abnormal discharge or drainage, and any areas of local tenderness. So that's how we perform the perineal care. So once again, this is Edmond M. Bigata. Thank you and God bless.